Well, I was born in Portland, Oregon, but I'm a military brat. My dad was in the military, so we were transferred here when I was maybe a year old. So I would say, yeah, I grew up in Orange County pretty much my whole life. I work for the Walt Disney Company. I've been with them for over 27 years. My mother was diagnosed with ovarian cancer. Unfortunately, she lost her battle about 2 years ago. But I just remember how great Hoag was with her and her treatment, and I knew that this was going to be the place for me as far as my treatment and who I was going to go to. I'm Kimberly Renica, and this is my story. I felt a lump in my right breast in November, and I really didn't think anything of it. I was able to see my OBGYN in December. By mid-January, I was diagnosed with stage 3 breast cancer. It was both in my right breast as well as my lymph nodes.
Kimberly came into us when she was first diagnosed. We like to see patients fairly quickly.
PRIA was part of the genetic testing that I did. That was really interesting to see my genetics, to see if I carried what was very common called the BRCA gene, and I don't have it.
Even if patients test negative, we tell our patients risks that they have based on their family history if they test negative, how their family members are affected by their history, because these individuals could still be at elevated risk.
The nice thing is that now my genealogy is now part of a worldwide study. At the time, my plan was I had a 5-step treatment plan. I was going to be doing chemo, surgery, reconstructive surgery, radiation, and then pills. Of course, that changed when I had more tests done, and then I was upgraded to a stage 4 where I was diagnosed with metastatic breast cancer, where it did metastasize to my bones.
There's a lot of raw emotion behind a new diagnosis. This is absolutely the scariest time in somebody's life. They don't know what's going to happen next. As a navigator, it's really important for me to know that the patient has emotional support, and then reassuring them that we're there every step of the way. I make sure that they have my contact information. I let patients know they can contact me anytime. Not every hospital is lucky enough to have nurse navigators. They really add an extra special touch to the hospital and offer a unique service that most hospitals don't provide.
One thing with cancer diagnosis, you get a lot of people like, can I do anything for you? Can I help you with? And I don't think I need any help. I don't know what I need. And so I think with a nurse navigator, they're open to all these opportunities to say, maybe you don't know what you need, but this might be really good for you. Because you just don't really know until you're there.
There's a surgeon, there's a doctor, there's an oncologist, there's radiation oncologists. There's so many people that make up a team for patients, and we're really the constant that kind of holds it all together.
Kimberly had a lot of information to assimilate with our first meeting, and we met for a good hour and a half and discussed her case in detail.
Many patients tell me that they don't feel like a number at Hoag, they feel like a whole person.
One thing that I think is great about the Hoag program is that we do have the time to sit with patients, get to know them on a personal level, develop a friendship and a trust, and I think that makes the whole treatment experience a lot better.
What I do is what I describe as a targeted imaging to help guide targeted therapy. Cancer cells express specific molecules within and on the surface of the cells. We can target those molecules by binding very specific other molecules onto those targets.
Because of Dr. Ulaner, my treatment completely changed. I'm no longer having to do surgery or chemo or any of the radiation. I'm now just doing these therapeutics, these 2 pills a day.
So if we can use smaller amounts of systemic therapies and reach that stable for a long period of time, then we can really benefit Kimberly, give her a good standard of living, give her a long period of life before the tumor causes her further trouble.
I'm still able to do all of the things that I really enjoy doing. I'm still able to do my Pilates. I love camping, but I'm more of the glamper. But with my diagnosis, I probably more enjoy all the things that I am able to do.
Personally, I thank the philanthropic community for allowing us to bring trials like this to people like Kimberly.
I think, the philanthropic aspect of things has been very important. It's allowed Hoag to offer services that we might not be able to offer otherwise.
The Circle 1000 really helps Hoag stand apart from the rest. Between the resources, the Comprehensive Cancer Center, Hoag really is a special place where I think patients really feel that and feel like they're part of a community, not just a hospital.
The Hoag Family Cancer Institute is recognized as being among the top 10% of cancer centers in the nation. I think it provides a state-of-the-art care to every single patient that it touches.
I think the overall care that I have with Hoag has been tremendous. I think with the support groups, with the doctors, with the nurse navigator, they're looking at me and my journey, and not just so much my treatment, but my life.
I'd like to thank Sandy Sewell and the visionary donors of the Circle 1000 group, who started over 34 years ago to help grow programs for the Hoag Family Cancer Institute. They've grown our Nurse Navigator program. They've grown our high-risk genetic counseling program, among many others. And now they're growing the molecular imaging and therapy program here at Hoag. And I can't wait to see what they're going to grow in the future.
I'm just really grateful to all the supporters out there who have helped me on my journey. And again, it's not a day or a week, it's a lifelong journey. And I'm just so appreciative that Hoag is part of that lifelong journey. And I don't think I would have it without you guys and your support.
Thank you, Circle 1000.
Thank you, Circle 1000.
Thank you, Circle 1000.
Thank you, Circle 1000.